Good morning. So I thought we'd start doing something different at what we used to do for the Health Nugget. So maybe we could learn some very basic, simple treatments that we could do at home, something that I already tried, so I don't like to talk about things that I have not tried. And I think when it comes to hydrotherapy, I tried on me and I gave it on others. Pretty much every hydro treatment you could think of, I tried. And this is probably one of my favorites because it's not invasive and it's not something that would make you want to die, especially like the fever treatment. That's the one I hate the most, but it's helpful. So this is something we all can do at home. And of course, there are some precautions that, of course, we'll mention that. So what is a hot foot bath? How many of you have tried a hot foot bath at least once in your life? Okay, so pretty much few. So it's basically you put your feet in hot water, and we have the temperatures here, 100, 104. And it's always very important to have a cold compress on your head, on your forehead, or even around the neck. So 15, 20 minutes, and if you want to get a little bit more intense, then you can wrap yourself with even more blankets and put more hot water and as much as you can tolerate. But it's very basic treatment, which does actually quite some amazing things. I practiced this for quite a while, especially, it's very good for headaches, as we learn, so it helps to balance circulation and decrease congestion in the head, lungs, pelvic organs, and internal organs. So the treatment acts as a derivative, which a derivative effect happens when heat is applied to a large area of skin, and its effect is to draw blood away from a distant internal organ. So you have headache, you put your feet in hot water, and it's kind of the circulation starts to, because sometimes when we have headache, when we have pain, crampings, it's because there is probably too much concentration of blood in a certain area, so that needs to be dispersed. And this is a very easy way to do that. So a hot foot bath draws congested blood away from the brain, lungs, and pelvis. As I said, if you want to start increasing also your white blood cells, you can wrap and stay a little longer. And this treatment can be done while you sit on a chair, but also if you are in bed, somebody just lay flat in bed and just have your feet in a bucket. So that can be done. I've done it both ways. Works wonders. Very basic, but works wonders. Now, some indications for the hot foot bath? As we said, it helps to relieve congestive headaches, chest congestion, pelvic congestion, stop a nosebleed, and aid in relaxation and comfort. And even it helps to shorten and sometimes even totally stop the common cold, influenza, and painful menstruation. And it's also useful for osteoarthritis in the feet if there is no pronounced swelling. And we also have to caution a little bit with the diabetes, but it can still be done. So in a randomized clinical trial of 60 diabetic individuals, a warm foot bath that contained 5 liters of warm, tolerable water with 250 grams of, I would say, Epsom salt, mineral salts, it helped to reduce the diabetic pain, the neuropathy that most diabetics have. It helps to reduce that pain. And again, as I said, it can be done if it's with caution. Now, it helps to improve sleep. Hot or warm foot baths are useful in cases of insomnia. So several studies suggest that when the feet are warm before retiring to bed, a person falls asleep faster and the sleep is deeper. So this could be very helpful for those who are anemic and have insomnia. And there are some contraindications. So people who suffer with circulatory disturbances, peripheral arterial disease, or impaired sensation, those with neuropathy, if there is somebody to measure the temperature, that still can be done, but if there is no sensation, then it's best not to be done. And also, if there is advanced blood vessel disorder, if the swelling of the feet is exaggerated. If you're just a little swelling, because sometimes all of us have a little swelling in the evening, let's face it, if you stand on your feet all day, we all experience a certain amount of swelling, but if it's more than normal, then that's also a caution for those with varicose veins, and of course for skin rashes on legs. Now, for those with rheumatoid arthritis or gouty arthritis, it cannot be done if they are experiencing like that hot and swollen, painful condition. And in diabetes, with a note that warm foot bath can be tolerated by most diabetic individuals. If there are good foot pulses present, diabetic individuals and individuals who have peripheral neuropathy can usually tolerate a 102 degree Fahrenheit foot bath. So it can still be done with caution, so we all could enjoy a little comfort. So there are a lot of studies, and those who want more references, I have them to show that this basic treatment will do wonders. So if you have any more questions, don't hesitate to contact me, and I'll be more than happy to talk more about it. As I said, I've tried every hydro treatment you could think of, and they're all amazing. Not pleasant, but amazing.